Being a new mother brings you into an entire different world of motherhood, something that you probably have not experienced before, especially if you're a first-time mother. I penned down what postpartum challenges or the journey could be like in my book, and it is written in chapter 7. So I titled chapter 7, Now This is Postpartum Life. Will I enjoy it? And I quoted Maria Joseph Valley saying, having my baby fall asleep in my arms takes away all of my worries and stresses. A sense of complete and total peace comes over me. Let me start to read. The delivery of a child finally welcomes a woman to a life of motherhood, with repeated greetings of congratulations. Undoubtedly, this is the commonest word she will hear all through the immediate post-delivery period, and this brings her into an experience of a lifetime. During pregnancy, every woman goes through spiking periods of apprehension about childbirth, and more so about what life as a mother has to offer. This is particularly true and more pronounced in first-time mothers to be. They have seen and heard about challenges and success stories of what being a new mother is, and there is the silent but powerful questioning in their individual, inquisitive minds about what portions will be their own. Nevertheless, once a baby is born, the reality of motherhood dawns on her, irrespective of whether she prepared for it or not. Your postpartum period begins immediately after the birth of your child to 6 months thereafter. The immediate postpartum period, which starts from the first hour to about 6 weeks, is usually the most critical, as you will experience many changes as a new mother. You will be with your baby in the hospital until you are deemed medically fit to be discharged home. Your duration of hospital stay depends on whether you have a vaginal or cesarean delivery. The presence or successful management of possible complications is another factor that will determine the length of your postpartum care on admission. Without serious complications, with natural delivery, you will be fit for discharge between a few hours to a day or two, but average hospital stay after natural delivery is 1 day. Following cesarean section, it ranges from 3 to 4 days, and presently maybe 2 days. The midwife monitors your general well-being as it concerns postpartum bleeding primarily, your vital signs, lactation, psychological changes, and your ability to create a bond with baby and initiate breastfeeding. The general well-being of your baby is also ensured. As your baby and you are prepared for discharge from the hospital, you will be counseled appropriately on exclusive breastfeeding, vaccination. Your baby should have had his first dose of vaccines by now. Good cord care, male child circumcision, and family planning. You will be given antibiotics, pain-relieving tablets, your routine drugs, as you need to continue using them for a few more weeks, and scheduled for postnatal follow-up visits. Where there are no concerns, this visit is usually at 6 weeks following childbirth. The uniqueness of this phase is your body's natural ability to return to pre-pregnancy state. There will be an almost sudden change in your hormone levels to accommodate for lactation and a final return to pre-pregnancy levels. Your womb will at birth and separation of the placenta descend to the level of your abdominal button as it commences its journey back to its former size. This will usually take about 6 weeks to complete. If you add perineal tear from your baby's head while he was trying to make his giant entry into the world, or you add an episiotomy administered surgically by cutting you with a sterile scissors, the midwife or doctor will help you repair it using stitches with appropriate sizes of sutures. The midwife will talk to you about home care of your repaired tear. The midwife will talk to you about home care of your repaired tear. It is called sitz baths. You will have bleeding following. You will have bleeding followed by discharge immediately after delivery, and this may take up to 6 weeks to stop. In the first few days, this bleeding, called lochia, will be bright red, signifying blood. It will gradually change color to become brownish. and then yellowish before it stops finally. Wearing of delivery perineal pads to absorb it is important, as they are clean and more hygienic than using pieces of clothes that are usually washed and reused. Using delivery pads will reduce your chances of getting bacterial infection. The use of tampons is not advisable because it will increase your risk of contacting these infections. During this period, genital soreness and swelling will also resolve. For women who develop hemorrhoids and swelling feet during pregnancy, you will realize that these will almost always also resolve. Your baby and you will immediately commence skin-to-skin contact after delivery with the help of your midwife, who will also help him initiate breastfeeding, except there is a medically your baby and you will immediately commence skin-to-skin contact after delivery with the help of your midwife, who will also help him to initiate breastfeeding, except where it is medically contraindicated. Most mothers may realize that they do not start lactating immediately after giving birth, but it is advisable that baby is continually put to breast until milk letdown starts, as the action of the baby's suckling of the nipples help to trigger this psychological process. In a significant number of women, breast milk production will delay till about the second or third day after giving birth. Here, their babies can be sustained on glucose solution and formula feeds, but before feeding a baby with any of this, he should have latched on the breast to suckle first. This should be discontinued once lactation is established. Newborn babies should be breastfed every 2 hours. It makes good sense for a mother to increase fluid intake to help increase breast milk production. If after a few days lactation is still not established, you will need to consult your doctor, who will assess you to rule out emotional or really hormonal imbalance or any related medical conditions like retracted nipples or nipples with blocked pores, and manage you appropriately. You will experience low abdominal cramps following delivery, and this will occur more when your baby suckles. This indicates that your womb is contracting and thus returning back to pre-pregnancy size. These contractions also help lochia to be expelled. Most newborn babies are usually awake at night. This adds to other experiences the newborn mother has, and it gives her poor or altered sleep pattern. Don't worry, it usually gets better over a few weeks. A good number of new mothers come down with one form of psychological disorder or another. This includes baby blues, postpartum depression, post-traumatic stress disorder, and puerperal psychosis. Mothers that experience baby blues may weep without cause, are touchy, feel sad, do not want to relate with their newborn baby, and may occasionally deny him breastfeeding. She may not even want to communicate with her husband or relate with any other person. She knows she has a problem but cannot place a finger on what it is or the reason for the same. Here, her husband needs to be patient with her and supportive. Usually, baby blues do not need medical intervention, as it resolves quickly in a few days, and she breathes newness again as she appreciates the fact that her recovery from her blues was spontaneous. I would continue with this chapter in the next video. Cheers.